The next thing that I think is important to know is ADHD tends to arise in early childhood and tends to persist over the lifespan. Now, that doesn't mean it's the same all the time. Sometimes it's better, sometimes it's worse. It just depends on the circumstances in a person's life. But contrary to what we thought in the 1970s, this is not a disorder limited to children. And then contrary to what we thought in the 80s, it's not a disorder limited to children and adolescents. We now have children, adolescents, college students, and adults who are dealing with ADHD issues. We do think that maybe as people get older, their hyperactive impulsive tendencies decline a little bit. You don't see adults running about and climbing excessively or not playing quietly. Those are not symptom descriptions of most adults, but they are part of the criteria for ADHD. So we're not really sure if hyperactivity impulsivity really changes over time and decreases, or maybe it's just that it takes on a different form, like mental restlessness rather than physical restlessness, and so on. Main point is this is a chronic condition that needs to be dealt with like many other chronic conditions. Clinical presentation. These are some important things for you to keep in mind. This is perhaps the most important, situational variability. ADHD symptoms are not always there. We never say that people with ADHD can never pay attention, can never sit still, can never think before they act. Individuals with ADHD do that just like everybody else. They don't do it as often, they don't do it as consistently, and consequently, when you do it less often and less consistently, it gets you into more trouble than the next person. So what is important to recognize about ADHD is some people will think, well, gosh, if, look at these symptoms, forgetting things, losing things, being disorganized, this could describe just about anybody. Absolutely. ADHD symptoms are not so unique that they only apply to people with ADHD. Everyone in this room does all of those things at some point. So it's not whether you do them or you don't, it's how often you do them and how many symptoms do you do and how much trouble does it get you into. Just by way of analogy, if we use the same analogy that some critics of ADHD use, then people would not be depressed because everybody gets sad once in a while. Or there'd be no anxiety disorders because people worry once in a while. So just like depression is on a continuum from very, very mild to very, very severe, and anxiety is on a continuum from mild to severe, the same is true for inattention, impulsivity, and hyperactivity. It's on a continuum, and so if you're way out on the extremes of that continuum, that's when it becomes ADHD, not whether you do it or you don't. The reason that this would be important is because if you brought a child into a doctor's office and it was a 10-minute exam and your child held it together for 10 minutes, your doctor might come to the wrong conclusion that the child does not have ADHD. Well, that would be incorrect because they didn't see it. You need to understand that there are some conditions under which you will see these symptoms and some conditions under which you will not. If kids are interested in what they're doing, you hardly ever see these symptoms. If kids are bored and the material is repetitive and familiar, you're going to see problems. Now, everybody in this room would show a drop in performance if they were doing something repetitive, familiar, and boring. But the drop for people with ADHD is much more substantial. We also know that in one-to-one situations, kids with ADHD do much better. In a group situation, they don't. Why? This goes back to the concept of self-regulation. When you are with an adult one-on-one, that adult is regulating 100% of your behavior. When you're in a group, the adult can't regulate your behavior 100%. All the other group members have to get some of that adult's time and attention. So as external control over behavior is removed, it places more demands on a child to self-regulate, which is what happens in a group, and consequently we see many more ADHD problems in group situations. We also know that when kids with ADHD are exposed to feedback, which is immediate, they do better than when it's delayed. When it's frequent, they do better than when it's infrequent. When it's meaningful, salient, they do better than when it's not. And there's some research that suggests in the presence of dads versus moms, kids with ADHD might behave a little bit differently. But in any event, these are important things to keep in mind, that ADHD is not an all or none, always there or never there. It varies according to the situation. This is a really important concept which you're going to refer back to. This might explain a little bit why a husband doesn't see it and a wife does, or parents don't see it but teachers do, or parents see it but a grandparent does not. And we'll come back to that a little bit later. So to sum up the point, when you have ADHD, it's not that you cannot pay attention, sit still, or think before you act, or do anything else. It's not a disorder of inability, it's a disorder of performance variability. So one of the hallmark features of ADHD is one day you show it and the next day you don't, and another day you show it and the next day you don't. It varies according to changes in condition. Now, most of us, when conditions in our environment change, can keep our behavior steady and constant. This is the challenge for ADHD. It's difficult to do that because it requires more self-regulation, which is the deficit. Okay. Now, another very important concept is that when you have ADHD, it affects multiple domains of daily functioning. Not the same for everybody, but if you look at groups of kids with ADHD and compare them to groups of kids that don't, you'll see more academic functioning problems, not doing enough work, grades that aren't as high as you'd expect. We would also see other behavioral complications like non-compliant behavior, not so much being defiant, although that can be the case, but because you're asked to do something and you start to do it and then you get distracted and you don't finish it. So it looks like it's non-compliance, but it's actually just not following through on things. This can affect social functioning. Other kids may have some of the same difficulties interacting with a child as a teacher or a parent might. Now, the other thing to keep in mind is that when kids with ADHD come to clinics, it is the exception that they come and get diagnosed with only ADHD. 60% of the kids with ADHD will leave with a diagnosis of something else. Most common among them would be oppositional defiant disorder, which occurs in about 40% of the ADHD population. In younger children, we see small rates of depression disorders and anxiety disorders. We'll see probably 30 to 40% of the kids with ADHD may carry a learning disability diagnosis, most commonly a reading disability. And I could go on and on and on. My main point is, and by the way, we did have a meeting a few meetings ago where we talked about all the things that can go along with ADHD. The main point to be made is that it seldom occurs by itself. It will occur in combination with other things, and that's important for evaluation, and that's important for treatment considerations. And keep in mind, as I talk about these things, I'm talking about as a group. More individuals with ADHD have these problems than individuals who don't have ADHD. It does not mean everybody with ADHD encounters these outcomes. But the reason we like to call attention to this is because it would be irresponsible of us to say, just deal with the ADHD and not tell you about the other things that could happen, because they will happen, and then you'll be caught off guard and you'll have a lot more trouble on your hands. So it's good to know what could happen in order to take steps to try to prevent them from